Here we are in New York City at the 55th Commission on the Status of Women at the United Nations. Family Research Council hosted 2 workshops. Both of them we feel are just incredibly important topics for women in developing countries to learn more and more about. The first was on chemical abortion and the disaster it will be in developing countries. The second workshop was on the psychological consequences of abortion on women.
This issue with medication abortions is not a pro-life or pro-choice issue. This is a woman's health issue. The risk of dying from infection following RU486 is 10 times greater than the risk of any death associated with an early surgical abortion. In the agreement that women sign when they take RU486, they sign that they have access to emergency services and are able to follow up. So in resource-deprived areas where women aren't able to have transfusions and aren't able to have ultrasounds and all of the resources that we have here in the United States, there's going to be a lot more deaths.
Well, that's one of the things that is just unconscionable about the people that are pushing medical abortion in resource-poor areas, because all of the adverse events that we went through, the 906 adverse events in the first couple years of mifepristone approval, those women are alive because they had medical care available to them emergently. Those women would be dead in a resource-poor country.
Now, what kind of treatment are you going to provide for a woman who's hemorrhaging in a place where you don't have the ability to do hemoglobin and you have no surgical facilities and no electricity? But this was probably the height of callousness. Women are followed up either by a return visit to the clinic or by telephone. What happened to the women who couldn't return?
Women don't know how dangerous these drugs are because the information that a woman gets is usually from a slick advertisement from the people who stand to benefit from the abortion.
They didn't even check these women for anemia prior, knowing that hemorrhage is one of the chief complications.
Well, I know that when I was trained as a young woman to be an abortion counselor, I was taught that there were no complications, there were no side effects, there were no problems. The only surgical procedure in the world with no side effects. But that's what I was taught, and that's what I told women. And unfortunately now, many years later, I know differently because women have come to me and have told me. But I do know from my own patients that many women are told the same thing. It's easy, it's no problem, you'll get on with your life. But many women are finding that they're left with a lot of grief and unresolved feelings that they need help with. They need an abortion recovery program. So no, I don't think that at the front end people are being given the information that they should be receiving. That 18% of their women had post-traumatic stress disorder after their abortion at 3 months. That figure is actually very comparable to men in the U.S. military who've been in combat over in Iraq. It's about the same, maybe 17 or 18% of those men come back with post-traumatic stress.
The scientific literature probably encompasses 500 peer-reviewed journal articles now, and there's substantial evidence that abortion is associated with 4 outcomes in particular. Abortion increases a woman's risk for anxiety disorders, for depression, for substance use and abuse, and for suicide ideation and suicide. Very clear systematic effects in the literature on those 4 outcomes.
There is a lot of pressure from UN organizations and from Europe Union organizations trying to have laws sustaining their way of believing and their way of life in our country. And it is hard that our politicians, they don't really have a choice in a way. If they want money to help our economy, they have to agree with whatever the UN or the European Union says. So I believe that we need to be heard worldwide.
Women's rights are something that are discussed at great length here at the UN, and in reality, we think it's incredibly important that our sisters in developing countries have full information with regard to chemical abortion and how this can impact their own personal health and how it can be ultimately disastrous and deadly for their sisters in developing countries. Women have a right to education about the psychological consequences of abortion. They have a right to the facts, to the academic cases, to the studies, to the real life stories that we know of our sisters who have suffered tremendously after making this decision. Women in developing countries have the right to the same kind of information that we in the United States have. And so that's why Family Research Council is here at the 55th Commission on the Status of Women at the United Nations.